Hi, my name is Jenna Leathers, and I'm going to be talking to you guys about healthcare reform and how it affects young adults such as you and I. According to the latest available census data, approximately 13.2 million young adults between the ages of 19 and 29 were uninsured in the year 2007, which is an increase of 2.3 million since the year 2000. Over the last decade, more and more adults have fallen through the cracks of our broken healthcare system. In fact, according to a report written by J.L. Nicholson in August 2009, though young adults comprise just 17% of the under 65 population, they comprise about 30% of the uninsured population. A common misconception, however, is that many young adults do not need affordable access to health care because they're less likely to need medical attention. However, in Nicholson's report, it's pointed out that 15% of young adults between the ages, again, of 18 and 29 have one of 6 chronic illnesses, either arthritis, asthma, cancer, diabetes, heart disease, or they suffer from obesity of some sort. In fact, more than half of young adults are above what is considered to be a healthy weight, and over 24% of young adults are considered obese. As far as the emergency room, injury-related visits are far more common among young adults than among any other children or older adults, and approximately 25% of these young adults had an ER visit last year. Now, my main claim that I'm supporting is that the new healthcare system is actually going to greatly improve healthcare for young Americans. And in terms of my supporting claims that I'm going to highlight, the first one just illustrates how the reform provides security in health insurance by allowing young adults to remain on their family's health plan as dependents until the age of 26. The second supporting claim that I will illustrate is that the health insurance reform will enable small businesses to offer their employees health insurance, which will be more affordable, and they will be provided with tax credits and relief to the businesses. And the third reform is that, the third supporting claim is that the reform will expand insurance options for young adults through something called insurance exchanges, and they will provide premium subsidies to ensure that this coverage is affordable. Now, before I get into a little bit of the supporting claims, I just want to explain a little bit more about some of the catastrophic problems that young adults face and why it's so important that they are provided with adequate and affordable health care. First of all, one of the biggest reasons many young adults go for a period of time without health insurance is due to the fact that when they turn 19, if they haven't gone to college or if they don't have an employee that's providing insurance for them, they're dropped from their parents' group plan coverage because they're deemed an adult. And even if they do go to college, oftentimes the cost of keeping them on a group plan with their family becomes considerably more expensive, and a lot of parents can no longer afford to pay for health insurance and afford to have their kids in college. Another reason so many young adults are uninsured is because they're newer entrants into the workforce, and they're less likely to start out working for a company that offers health benefits. Many young adults work multiple part-time jobs, and none of those part-time jobs offer health care, so they don't have access to it, and they also, in many cases, will work for a small company which cannot afford to provide health care for their employees. In fact, there was a survey by the Biennial Health Insurance with the Commonwealth Fund in 2007, which said that only 53% of young adults were eligible for coverage offered by their employees, compared to 74% of 30 to 64-year-olds. Now, as far as my supporting claims in why I believe that the health insurance reform will benefit young adults, the first reform, which I mentioned, was that it provides security in health insurance, and it does this by allowing young adults to remain on their family's plan as dependents until the age of 26. This applies to either students or non-students, and for those who don't remain on their family's insurance, the reform will create an insurance exchange which offers plans that are not employment-based, so it ensures that young adults will always have access to coverage whether they are or not employed. The second supporting claim, which again I mentioned, was that small businesses are going to be able to offer more affordable health insurance to their employees, will be available because the reform will provide tax credits and relief to these smaller businesses. And a huge gap in the coverage of young adults that were not insured will be bridged because, just a bug flying around me. Sorry. Okay, that's not fair. So anyway, so as part of the reform, the smaller health companies will be providing tax incentives to be able to give their employees better coverage, and that will start being enacted next year. The third reform will put a cap on what insurance companies can force young adults to pay in co-pays. It will also put a cap on deductibles and out-of-pocket expenses. It will put a cap on the amount insurance companies can spend on non-medical costs, such as the hefty salaries that are paid out to insurance company executives. And all of this will help keep insurance premiums down, which supports my third claim that the reform will expand insurance options for young adults through insurance exchanges. So in conclusion, I believe it is for this and many other reasons that Americans will benefit from healthcare reform, particularly young Americans. As I stated above, healthcare reform will provide security in health insurance, extend the amount of coverage offered by employees, and expand the types of insurance offered to young adults, along with providing coverage for those who are not employed. Thank you.
All right, you've got a good opening setting up the subject for this particular audience and why they ought to care about it. It takes you a while to finally get to your claim. You lay out the secondary claims. The first one's not really phrased as a claim. It's just kind of a signpost to what the point is on that particular point. The second two were phrased as claims. It took you 4 minutes to actually get to the substance of your argument. There's a lot of background information. And then once you get to those supporting points, that's where you stopped presenting evidence and you just presented what the program is. There's not much of a demonstration that that program is going to work or that it's going to be effective. For instance, are the tax incentives going to be sufficient to offset whatever costs the small businesses are going to incur, for example, and would it be more valuable for them to go ahead and accept the penalties instead of trying to cover those costs? There's some controversy about those issues, but I didn't hear any evidence from you that says that that's going to happen. Just here's what the policy is supposed to do. At one point you said, for instance, that it's difficult for parents to have their kids on insurance and pay for college at the same time, and yet later on we're supposed to be able to keep our kids on our insurance until they're 26. You know what? You've got to have a pretty cooperative parent that wants to do that. I'm not sure. I'm sure that there are plenty who are out there. I'm one of those people, but I'll bet there are plenty of you out there who your parents want you out the door as fast as possible. They're done with you, you know. You know, oh yeah, I'm going to spend 5 more years covering you on my insurance. Screw that noise. I need some money. You know, so the notion that that's going to have an advantage, I think there's an idea there, but again, that's not quantified. I thought you did a good job showing that there's a need in the first part when you're setting up the argument, but in showing that it's going to work, that there's a little bit of a problem that's underdeveloped. All right. Thank you.